Thank you, Senator Sessions. And Mr. Chairman, I'd like to agree with you that I think it's crucial that we have a plan. I certainly want to extend my hand. I'd like to do everything possible to work out a budget resolution. I think that's just absolutely crucial to restore some confidence, reduce some levels of uncertainty, because as somebody who has been in business for 31 years, made investment decisions, hired people, created jobs, I mean, I don't think there's any doubt that really what's holding back our economy is the high level of uncertainty and just a total lack of confidence in what's going to happen with our economy. And I think so much of that is driven by what's going to happen with our government. And, to me, it really is the root cause of our problem is the size, the scope, all the regulations, all the intrusion of government into our lives, into economic decisions that businesses have to make, and the cost to government. And I couldn't disagree more with Dr. Blinder in terms of the fact that debt and deficit doesn't make a difference. I think it makes a huge level of difference. When business owners see $4 trillion in additional debt and deficit accumulating just the last 3 years, trillions in additional deficit spending occurring over the next 10 years, that scares people. And I guess it was, Dr. Prakken, you were talking about the level of uncertainty in economic forecasting. It's making your job harder. Think of a job creator, a business person, the level of uncertainty when he's having to put his own money on the line or her own money on the line to make those investment decisions. That's the problem. And Dr. Brannon, I totally agree with you. I don't believe government can positively affect that in terms of its actions. I don't think we're good enough to say, hey, let's spend another $300 billion and juice the economy. What government can do is get out of the way. So the questions I want to ask you, first of all, thanks for your testimony. The deficit risk, the additional deficit risk that nobody's really talking about. I certainly worked with Douglas Holtz-Eakin in terms of the estimations on the true cost of the health care law. I think one of you were talking about the uncertainty around the health care law. The CBO estimated only 1 million people would lose their employer-sponsored care and get put in the exchanges under highly subsidized rates. But the McKinsey study found 30 to 50% of employers right now are planning on dropping coverage. 180 million Americans get their health insurance through employer-sponsored care. If half of them lose their health care and get dumped in the exchanges, the cost of Obamacare won't be $95 billion, it'll be over $400 billion. If everybody loses, it'd be close to $1 trillion. I just kind of like your comments in terms of that level of risk in your economic forecast in terms of debt and deficit. Dr. Prakken.
Thanks for such an easy question.
Not a problem.
I have no way of quantifying the impact on an intermediate-term economic forecast for the United States economy of the Affordable Health Care Act, because the name of our firm is Macroeconomic Advisors, and much of what is going on in healthcare reform is a microeconomic phenomenon in particular markets, segments of the markets, particular populations. I think I'd be a little careful with the example that you just gave. If a firm drops its healthcare coverage for its employees, what happens to the money that it saves when it makes that decision? Okay? Does it simply turn around, as it could, and give that to their workers as a higher wage? In which case, the workers could use that higher wage to go out and buy health insurance on one of these exchanges. So it's doing these analyses is extremely complicated. I think what you have to come back to is this. We have a huge unfunded federal liability over the next 75 years as the actuaries account these things. I think we'd all agree here that the principal source of that is healthcare, Medicare and Medicaid. Furthermore, given the way CBO estimates these costs, they make very optimistic assumptions about what's sometimes called the excess growth of healthcare, how fast it grows over the rate of GDP. Okay, these unfunded liabilities are probably even larger than CBO estimates. Yet our response to this unfunded liability is not to tackle head-on that issue. It's instead to whack discretionary spending over the next 10 years.
No, excuse me. Our response,
yeah.
our response is to increase the unfunded liability. That's the point I'm making.
But not within the system, not within the
Dr.
healthcare
Brennan,
system. So,
I'd kind of like to have your comments on that. I mean, the level of uncertainty caused by these deficit risks that we're not talking about here in Washington because we're simply not even addressing the ones that are already on the table in economic forecasts. I'll throw just one more into the hopper. You know, Dr. Blinder, you talked about 2.5% growth. You know, there's a study released by the Lindsay Group. If we only achieve 2.5% growth, add $5 trillion to our debt and deficit. The CBO estimates for every 1% decrease in economic growth, add $3 trillion to 10-year deficit figures. These are the risks. This is the level of uncertainty that is causing job creators not to act, not to invest. Dr. Brannon.
I think the biggest problem we have with health care right now wasn't really dealt with by the Affordable Care Act. It's the rising entitlement cost. I think that's the thing that really threatens the solvency of the federal government. And also, I think that's what employers are scared about more than anything. There's no denying that lots of small businesses in Oshkosh and elsewhere are really worried about. They're trying to figure out what these costs are going to do, and I don't think any of them really believe that their health care costs are going to go down all that much. But the fact that if you look at just the balance statement, the balance sheet of the United States, we might have had $1 trillion deficit last year, but the amount of unfunded liabilities went up by $3 trillion last year alone. I think that's what frightens financial markets, and I think that's really where the federal government has to make first in terms of their priorities. You're right. There's a lot of things in the Affordable Care Act, I think, that aren't really solving anything.
Okay, thank you. I'm basically out of time, but thank you, Mr. Chairman.